have you ever placed a patient in a plastic bag before?
Yes.
Yes. Okay.
Yes.
And do you think you could kind of tell me, if you remember, how that felt the first time you ever did it?
I think the first time that I ever did it, I was pretty young. I think I was 19 years old, and I think that's pretty impactful on young kids that are wanting to pursue this profession. And so it felt a little bit weird.
Absolutely.
But yeah.
Totally. How about you? Do you remember?
I definitely remember. I think it was when I first started working in the ER service at the hospital. It was definitely uncomfortable and kind of just to the point where you're like, I have to do this, and I kind of just want to do it and get it over with and just move on.
Absolutely.
Because like it is like, I mean, you think of your own pet, I think, when you're doing it. And
right.
So it just kind of a lot of mixed emotions, but again, like you kind of just have to move on.
Absolutely. It's like a let's get this over with moment and go on to the next patient because I can't think about it.
Exactly.
Absolutely. So they actually both use Euthabag at the A&M. It's the teaching hospital, correct?
Yes.
Cool.
Yes.
So then, okay, let's switch it then. Do you guys remember the difference, that like what you felt whenever you used a Euthabag for the first time?
Definitely feel like I felt more comfortable like presenting the owner with their patient in a Euthabag a lot more, because like it is like it's a bag, so it's a lot more, I feel like, appropriate to put patients in. And like for owners to be like more comfortable receiving their pet back that way, I think is a lot easier for them, especially like in that hard time.
Absolutely. How about you?
I definitely feel like, especially people naturally compare veterinary medicine with human medicine. And so I think it just aligns their expectations a lot better with, you know, like the idea of a body bag. It's not a trash bag, but it's something that, you know, you yourself could end up in one day.
No,
and so, you know, it
absolutely.
really just like, it makes us more parallel with human medicine rather than deviating off into our own thing.
Yes. No, I love that so much.